exactly what we want. It's infecting tumors and not normal tissue. It potentially is a target therapy we can use to treat people. And so we did this experiment now in people, and we're beginning to see some interesting results that we're excited about. So these mouse experiments sometimes don't pan out, but sometimes they do lead to important therapeutics. So here's a gentleman who had liver cancer, and unfortunately, during this disease, he got this large tumor on his neck from his liver, and it got to be so big that he couldn't turn his head anymore. He was suffering from this disease. He was losing weight. He was on his way out. It was not looking very good for him. We were allowed to inject him with one of our viruses, and as you can see, that tumor eventually completely resolved. He began to gain weight again, and actually became healthy again. It's really a very nice response. This gentleman here is a real superstar in our trial. And so on the top, I want you to look, those are two CT scans we're looking down from someone's body in this plane. If you look over here, that thing inside the red circle there is a kidney tumor that's now metastasized into his abdomen. So just to give you some bearings, that would be his spinal column there coming up towards you. And after you see treatment with the virus, you see that tumor's gone. Whoops. How am I doing this? There we go. Yeah. You can see that tumor's gone. So quite remarkable. And a whole body scan, which is on the bottom there, you can see these circles show where the tumor was before and after treatment it's gone. And this whole body scan. So really quite a remarkable response. This gentleman has gone back to work as construction. So really profoundly changed someone's life and this starts to work correctly. This is a lady in Hamilton that we treated. You're looking at what's the baseline over here. You're looking at her liver and this ugly thing hanging off the end is a tumor. It was treated, and after a few days, it started to change shape, change the way it looks. Eventually, it completely is eliminated, and she's about 3 years now, seems to be completely cured. So that's interesting because it says we can make viruses that can specifically infect and destroy the tumor. And now, I should mention that these people who have the side effects that they experience in this treatment is they get the flu for about a day. So they get a fever, nausea, they don't feel very good for about a day, and then it resolves. And that's the only side effects we've ever seen. So that's what the virus infecting the tumor, destroying it. But science is really interesting because you learn something every day, as I continue to do. And this is Kelly, who works in my lab. And she said, John, I have this great experiment I want to do. And I said, it's going to cost a lot of money. Kelly, I don't like that experiment, don't do it. So of course she went ahead and did it anyhow. And it's turned out fantastic. So this is what I thought. So this works in my lab. Kelly said, what if I stick a tumor in a mouse, and that's down here, you can see the tumor, that's a cartoon, we see the tumor in the back of a mouse. We treat it with a virus, and we eliminate that tumor by virus infection. We now cure the mice, we keep it in the lab for over 7 months, and that's a long time, these mice live for about 2 years. So almost half its life, that mouse has been cured of its cancer. And now Kelly says, I'm going to try to get cancer again. So she re-injects those mice, and she finds that all the mice reject the tumors. And what she's shown is that as the virus destroys a tumor, it educates the mouse immune system to recognize the cancer is born, and the mouse develops immunity against the cancer, preventing it from coming back. Wow. This is the opposite of what we see, unfortunately, in chemotherapy. So that's really quite exciting. That's just a mouse trick. It doesn't happen to people. And here's a lady who had melanoma, and we're looking at her thigh there. And where those red arrows are pointing are in tumors on her thigh that were injected with virus. And those tumors resolve, disappear. You can see afterwards there's no tumors there after vaccine, just white spots. If you say to a clinician, what are those white spots on a person's skin? Those have a condition called vitiligo. And what vitiligo is an autoimmune reaction against that part of your skin. Your immune system reacting against that part of the skin. So just like in the mice, this lady developed immunity against her tumors and began to eliminate them through her body. A real graphic example of what's happening in another individual. This is the man who was in Pittsburgh, who a friend of mine was using one of our viruses in Pittsburgh. And you can see on the bottom here, that's right here, you can see that's his arm. He's got that massive lump on his arm, which looks quite ugly. You can see the black circle as we go back up to the top there. That's inside the black circle, these small little tumors. Actually, I can take it this way. Right in here. These were injected, and after a few days, they began to disappear, go away, cavitate, eventually completely gone. What's really impressive is down here, this big massive tumor, you can see over time, is retreating and being eliminated. So when we analyze that tumor, we look at the size of the immune system had redone this. So this man's immune system had also mobilized to recognize his cancerous and eventually eliminate it. I'm just going to end by telling you about something I'm really excited about, and that is that I think these biological approaches to cancer are really important. It's a new way to treat cancer. It's not called cancer, it involves biological materials. And we are forming a network that's going to be centered here in Ottawa. We're applying to the government for the support to do this, called BioCan. And the idea is to sort of link together scientists from across Canada to work on cancer together with these biological kinds of approaches. So what we're going to use are viruses, what I've been talking about, also immune cells, because you've seen the power of the immune system, and antibodies. We're going to try to combine these together in a rational way to make better therapeutics and have people treated in a way which is much less painful and much less debilitating and hopefully much more effective. So this network is now being set up across the country. It's going to be headquartered here in Ottawa, we hope. And it's linking together scientists, clinician scientists, social scientists, and a lot of other people working together on this problem together. This will be an example of another kind of therapy. I'm talking about viral therapy. There's also this concept of cellular therapy. There's an interplay between cells and viruses. And we now know that you can take patients, in some instances, you can isolate their immune system outside of their body, you can educate it outside the body, and reinfuse it back inside the patient. And you can teach their immune system to recognize the cancer is born, just like mice do, and start to eliminate tumors. And this next one is a bit of a graphic picture, but I think it really brings home the message of how powerful this can be. This is a gentleman who had large growth, large tumor in the back of his head. Really did not survive much longer. He had his immune system extracted, re-educated into that head, and you can see that eventually he eliminated that entire mass. So it's really a phenomenal approach that we really want to try to champion going on here in Ottawa, Canada. There's a story in Time magazine of this young lady who had ALL, acute lymphocytic leukemia, really at the time of her going on experimental immune cell therapy, she failed all options. She had bone marrow transplants, nothing worked for her. At the time they treated her, she had over 1 kilogram of tumor circulating in her body. And she had immune cell therapy and had a complete response. And so the fellow who did this work in Pennsylvania, as I spoke to recently at a meeting, he's treated 22 kids, 19 of them had complete responses. Absolutely dramatic. But we don't have this in Canada yet, and we should have it in Canada. So that's what we're trying to put together, this research network that will allow us to bring these kinds of treatments here, combine with our system, our other people. So anyhow, I just want to end there and say I think there's a lot happening in cancer right now. There's a lot we can do to make things better, and I think we're getting a lot closer. The 30 years I've been doing this, I've seen a lot of no progress for a long time. Let's say the last 5 years, it's really starting to take off. So I'm very optimistic in the future we're going to have a real big impact on a lot of these diseases. I think in the past we've said to our oncologists, try to cure cancer with chemotherapy. It's like saying to a fireman, here's a forest fire, put it up that shelf. He can sort of keep it at bay for a short time, but ultimately it'll fail because chemotherapy is not very targeted and only attacks in one way. We think we want to use biological therapies like viruses because they directly infect and destroy the tumor, but they activate your immune system. We know they also affect the blood supply to the tumor. Really attack the cancer in multiple different ways at the same time. Don't allow it to mutate and basically are able to eliminate it. And that's the approach I'm really trying to push. This is really being developed in large part at the Cancer Center on Smythe Road at the Ottawa Hospital, where we have people like Kelly who do discovery work. Because of some great support we got from the Ottawa community, we're able to make a manufacturing suite. And now, one more time. We can now manufacture viruses that we discovered and then test them in the Cancer Center downstairs. If they don't work, we go back to the lab and fix them up and repeat this cycle. We can do this now in about a 2-year time frame. Usually it takes about 12 years to go from discovery into the clinic. So we really have foreshadowed this a lot by doing this kind of innovation. And really, it's because of the support of all of you, no doubt, through the Ottawa Regional Cancer Foundation, through the Ottawa Hospital Foundation, of course, you've heard the Pancreatic Cancer Society is actually just this year supporting us well and trying to develop some therapies for pancreatic cancer and the Purple Team, which is here and involved and help Jackie raise money this year for this equipment we use in our manufacturing facility. So really, it's because of these people in this room who are able to do the work we do. I just end up having to always talk about my work. It's something I enjoy doing. I think it's important for people to know what I'm doing. You all I thought I didn't have to do this, but I don't know, 8 years ago, this article appeared in McLean's, and okay, everybody knows about this now. I don't really talk about it anymore, but that was not the case. It really was brought home to me. I was giving a talk at McGill, and I got back to my hotel room, and there's a phone message from my oldest son, Terry, who was at Queens at the time. Terry's calling me. He's only calling me sick, but he needs money, so why is he calling me? So I called him and said, Terry, are you okay? He said, yeah, I'm fine, Dad. There's nothing wrong. He said, but did you watch House tonight? And everybody see House, right? And I said, no, I didn't watch House. I was giving my lecture. He said, well, you should watch House tonight. Because on House tonight, this lady had breast cancer. She got a herpes virus infection, and the breast cancer went away, so the stuff you're doing isn't working, Dad. I saw it on House. So it's an important topic. And I'm actually speaking on behalf of all these people. These are the people with my group here in Hamilton and across the country, actually. This is a picture taken by my father-in-law's daughter. Actually, we have a retreat at his cottage. And we have a little too much beer, but we have a lot of talk and discussions. And it is where the ideas come from. So on their behalf, I'd like to say thank you very much for your attention and for all the support you've given us over the years.